If you just stumbled across this page, you're likely trying to solve a very specific, high-stakes problem. Maybe you're an oral surgeon or periodontist wondering if adding robotically assisted technology to your operating room is a genuine breakthrough or a slow, expensive marketing gimmick. Maybe you're an ambitious clinician who wants to own the entire full arch process from surgery to lab fabrication, but you're looking for practical tips from someone who has already built the infrastructure. Or you may even be a patient who has done everything right, yet your teeth continue to fail one by one due to genetics or prior dental trauma. You're probably completely exhausted by constant dental work, terrified of undergoing surgery without deep anesthesia, and looking for a permanent, definitive solution. My name is Dr. Daniel Yang. I happen to be a dual degree oral and maxillofacial surgeon, and I built this channel to serve as a completely transparent, zero hype space for advanced modern implantology. Now, for my colleagues in the dental profession, we're going to look past the profit-driven corporate pitches and dive straight into the raw clinical mechanics. I'm going to show you exactly how we navigate the learning curve of the Yomi S robotic surgery, integrate TRI no-abutment implants to eliminate prosthetic screw failures, and utilize a fully digital workflow with our in-house lab and milling for superior results. And if you're a patient searching for a permanent way to reclaim your smile, I want to take away the fear of the unknown. So on this channel, you'll get a front row seat into our modern operating room and how our advanced workflows combined with deep IV sedation allow you to drift through a peaceful nap to wake up with your freedom completely restored. Whether you're here to optimize your private practice workflow or looking to safely transform your smile, you are in the right place. I invite you to hit follow, explore clinical resources, and join the conversation in the comments. Let's build predictability together.